It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi everyone, I'm Sam Lesante and welcome to The Sam Lesante Show. Now today's show is The Sam Lesante Show, but with a little touch of eye care today. And you know you watch that show every day on SSP TV. Now, why am I here at Hazleton Eye Specialists? It's because we have something really exciting to talk about. Now you've heard about macular degeneration. Yes. Now, Dr. Thomas Kislan, who is the medical director of 5 locations. So we got to get the Hazleton Eye Specialist, Pottsville Eye Specialist, Nanticoke Eye Specialist, Strasburg Eye Specialist, and Bangor Eye Specialist. And the main man himself, the medical director. Thomas, it's nice to see you.
Good to see you, Sam. Thanks for coming.
It's nice to have you on the Sam Lesante Show.
You never invite me, so I had to invite myself.
I had to give you that enormous amount of money to get you on the Sam Lesante Show. But anyway, when we're talking about macular degeneration, before we get to that, sometimes I know what happened to me, okay, maybe 5, 6, 7 years ago. Dr. Bucci did my eyes a while, maybe 15, 20 years ago. And I figured, well, what do I need an eye checkup for? And all right, fine. So, came to you and you did an eye specialist and you said, Sam, we detect something here, okay? And luckily I came at that time because I would have never known that something was happening in my eye with macular degeneration, all right? So how often should someone just go for a general eye checkup?
Yeah, so I think, a young, healthy person, I think usually once every year or so when you're young, and once we get into our 60s, 70s, probably every 6 months, just like you go to the dentist every 6 months. So we're lucky if we can get patients to come that much. A lot of younger patients, it's every 2 years, every 3 years, because like you said, you don't know anything's going on until there's a problem, and then sometimes it's too late. So, in medicine we preach preventative care. And it's the same with eye care. If you're a young patient, come once a year, get your eyes checked, make sure nothing's going on. And if we do find something, early detection is the key. Macular degeneration is a disease that affects the back of the eye or the retina. So think of the eye as an old-time camera. Light comes into the eye, it's focused on the back of the eye, which is the retina, which is kind of the film that takes the picture, sends the message to the brain, and allows us to see. The retina, as we get older, can actually degenerate. We can get some deposits that build up in the back of the eye. These are deposits of lipids and proteins and some other things. And those deposits, over time, can actually degenerate the retina and cause us to slowly lose vision. And then what can happen, there's 2 types of macular degeneration. There's what's called the dry form, and there's what's called the wet form. So the wet form is probably the least common. It's probably about 10 to 15% of all macular degeneration, and that's where there's bleeding inside the eye, and that bleeding can basically take your vision overnight. You can lose your vision. You can just wake up one morning and your vision's gone.
Is there any signs that would tell you that something's happening?
Well, early on there might be some waviness in your vision, maybe some blurriness, but honestly it can just creep up on you. So that's why early detection is the key, and getting checked, and if there is a start of macular degeneration, there's some things we can do to be proactive, which we will talk about. But the wet form is the worst form, because the only treatment for that we have now is injections of medicine that we do into the eye every 5 to 8 weeks for the rest of your life. And if you don't do them, your vision gets worse. So macular degeneration is a progressive disease that does get worse if we don't do anything. Sometimes it's very slow. Other patients, it's very quick. I'll have patients we diagnose in their 50s and it doesn't change much. I have other patients we diagnose in their mid to late 60s and it progressively gets worse. And it's heartbreaking, because I have patients say to me all the time, I wouldn't care if I lost my hearing, but my eyesight, I don't know how I would function. So that's why getting your eyes examined at an early age is very critical, because there's some things we can do now to be proactive with this condition.
And what's the dry you said?
Yeah, so the dry is the most common form. So most patients, when you diagnose them, the dry means there's no bleeding yet. We have these deposits, they're called drusen, that build up in the back of the eye, which we can detect on exam. And again, you've known me a long time. We always have the best technology here. We have digital imaging. We take digital images of the back of the eye that we can show patients what's going on. We have a machine called an OCT, which basically it's almost like a CAT scan of the retina, takes cross sections so we can see the underneath layers of the retina. And by looking at that, we can detect dry macular degeneration early. And up until now, the only treatment for dry macular degeneration has been to protect your eyes from the sun, because getting older and UV damage is what makes it worse. Eat a good, healthy diet. Don't smoke. Smoking increases your risk of this progressing by almost 11 times. And some nutraceuticals, some vitamins. And we've talked about the PRN nutraceuticals before. They have 2 products that are very good in helping to slow down the progression. But no matter how we slice it, macular degeneration gets worse.
It's interesting because, I come here every 4 months for, the checkup. But when you talk about technology, and that's where the key is, I think, is you have all these advanced technical machines, I call them, okay? And you're able to determine everything in the eye, okay? There's things sometimes you see in the eye, that like maybe can affect your high blood pressures, things that, when you're looking in that eye that you can detect. Am I correct in saying that?
The eyes are the only place in the body where we can see living blood vessels without cutting you open. And, I tell patients what's happening in the eye is happening in the heart, it's happening in the feet, it's happening in the kidneys. I'll give you a quick example. I just saw this patient yesterday, not to do with macular degeneration, but I saw him for an exam. He comes every 6 months, and I noticed he has some diabetes, and I noticed that he had some diabetes in the eye that was asymmetric, right eye versus left eye. Now, we have 2 blood vessels coming up in our neck called the internal carotid artery that feed blood up to our brain and our eyes. So everything should be symmetric in our body. Well, he had one eye that looked actually worse than the other. So I sent him for a scan of his carotid arteries, for a carotid scan, and it turned out that one side was almost 90% blocked.
Wow.
So he's on his way to see a vascular surgeon and probably get this opened up, because if not, he probably would have a stroke at some point.
Now, is there any age that the macular degeneration hits the most? I mean, I know it could hit any time, but what is the most?
It's probably over 60 is when we'll start to see it. Yeah, that's especially around here. It affects whites. It's kind of light-skinned, light-haired, light-eyed people. We have a lot of Irish Catholics around here.
Exactly.
So it's a very prominent condition in fair-complected people. Again, smokers and and women. It's almost 4 to 1 over men. So those are the risk factors that we look at. And unfortunately, a lot of those risk factors aren't modifiable. I mean, we can't change who we are. We can quit smoking, we have a better diet, but other than that, genetics and who we are, that means it's probably going to get worse if we do detect it.
So you mentioned about the PRN, which I use every day. Why are those, what do they do for you?
So in early macular degeneration, we know that there's an inflammatory process that's happening in the retina. When those deposits in the retina accumulate, it causes inflammation. So the one product that PRN has is called New Macula Omega, and it was actually developed by Wills down in Philadelphia, and it's a combination of a high quality omega-3, lutein, zeaxanthin, and vitamin D3. And all of those ingredients in clinical data has been shown to be anti-inflammatory, slow the inflammation that happens in the retina, and slow down the progression of the macular degeneration. Plus, it's omega-3s are good for your heart, skin, joint, cholesterol. There's other benefits also. And then they have another product called New Macula Vitamin, which is a combination of antioxidants. So things like C, E, B complexes, niacin, things like that. And those have been shown, the antioxidants have been shown also to help slow down the progression. Now, a little bit more in an advanced macular degeneration, they work a little bit better. But really, if someone has macular degeneration, they should be on both of those products.
All right, so my friends, I'm here with Dr. Tom Kislan. He is the medical director of Hazleton Eye Specialists. 5 locations. Let me tell you, if I hadn't gone to get an exam maybe 5-6 years ago, I don't know if I'd be able to see as well as I'm seeing today. So I highly recommend, please go and get your eye checked. But if we have macular degeneration, whether it's dry or wet, we're going to come back and talk to you about this machine, which is unbelievable. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. I'm Sam Lesante, and once again, thank you for making the Sam Lesante Show the #1 talk show in northeastern Pennsylvania. I appreciate that very much. Now, I said the Sam Lesante Show, but we have a touch of eye care today, and you see that show every day on all of our channels. We're with Dr. Tom Kislan, who is the medical director, the founder of Hazleton Eye Specialists, Pottsville Eye Specialist, Nanticoke Eye Specialist, Bangor Eye Specialist, and Strasburg Eye Specialist. Now, if you just tuned in, we're talking about the macular degeneration. I highly recommend you watch the first part of the show. You know, you could watch it many times. We're talking about why you should get an eye examination. But if you are diagnosed with dry or wet macular degeneration, we have, which is sitting right here, a little device called the Valeda. Now, tell us why this is an innovation and why this is so exciting for those people who may have macular degeneration.
So what I can say to everyone watching, if you or anyone you know has macular degeneration, they need to watch this show, because this instrument device behind me might be the most innovative thing that I will ever see in my career as an eye doctor. So macular degeneration, as we talked about, 2 types, dry and wet. The dry form is the most common. Eventually it leads to progression. It's the leading cause of blindness in the United States. If it turns into the wet form, patients need an injection once every 5 to 8 weeks for the rest of their life so they don't lose their vision. Up until now, we've had nothing that not only reverses macular degeneration, prevents progression, but this is the only treatment we have now that actually will restore vision in someone who's already lost vision from dry macular degeneration. This device, it's called photobiomodulation. That's a long word for red light therapy. So using certain wavelengths of red light that we basically have the patient look at, it directs the red light to the macula, and it actually, on a cellular level, helps restore the mitochondria in the cells, which helps those cells to not die and makes those cells work better and keeps the tissue healthy. So this technology has been out since 2019 in Europe. And in Europe, they've treated over 500,000 patients. So finally, in November of this year, this technology was approved by the FDA in the United States. And this has happened very quickly, but the company Lumathera brought this device to market. It's the same device they use in Europe, and it's now available in the US. And I'm absolutely proud to say that we are the first eye care facility in Pennsylvania to have this device. Yeah, so Will's Eye doesn't have it yet. We got it before Bascom Palmer. We got it before Mass Eye and Ear. We got it before Will's Eye. We got it before everybody because we knew this was something we needed for our patients, and we made the investment in this technology. So when I say we have the ability to help prevent someone from going blind, it is now in Hazleton, Pennsylvania, and nowhere else. There's 4 in New York, 4 or 5 in New York. There's 3 in New Jersey and 2 in Baltimore. That's the closest to our area. So patients do not have to travel out of the area to prevent from going blind now. And it's a very simple treatment. It's 4 minutes and 10 seconds an eye if we're treating both eyes. Now, if someone has dry macular degeneration in only one eye, we treat one eye. If they have it in both, we would treat both. But it's 4 minutes and 10 seconds per eye. Patients do have to come, so it's a time commitment, so it's not one treatment. They actually have to come 3 times a week. for 3 visits over 5 weeks. So they have to come, let's say, Monday, Wednesday, Friday, and then they have to do that 2 more times within 5 weeks. So that's 9 treatments that have to be done every 4 months for 2 years. So it sounds like a lot, but
you're saving your eyesight.
There's no drops, there's no anesthesia, you can drive, there's no injections,
Wow.
there's no side effects, there's nothing except preventing you from going blind. So, you know, when I really think about my career, and, you know, I've been doing this 29 years now, I can absolutely say this is probably the most impactful thing I have ever seen, and probably that I will ever see while I'm alive. You know, we've never been able to look a patient in the eye who has macular degeneration and say, I'm going to prevent you from losing your vision. We would say, take these supplements, it's going to slow it down. Don't smoke, it's going to slow it down. We hope it doesn't get worse. We're going to pray it doesn't get worse, but I can't guarantee you that it's not going to get worse. We finally have the ability to say to a patient, with this treatment, we are going to slow the progression. We are going to restore the tissue that's been damaged and improve visual acuity. In the studies, they've shown about a 1-line improvement in visual acuity after a 2-year treatment, which doesn't sound like a lot, but if a patient is unable to drive because they're 20/60, which is the PennDOT standard kind of for vision in Pennsylvania, and we can get them to 20/50, now they can drive. They can see TV, they can read, they can look at their grandkids' emails. So the ability to change someone's life is now in Hazleton, Pennsylvania. And actually we have this device in our Stroudsburg office also, and we're going to have the technology also available in Pottsville. So our 3 main locations, we will have it available to patients. Our Bangor and Nanticoke patients will just have to travel because it's not that far. Nanticoke's 25 minutes from here. But we think that we'll probably see patients from Wilkes-Barre, Scranton, Bloomsburg, Binghamton, because there's no one else. There's no one else around. So again, if folks are watching this show and they have relatives that are in Binghamton State College, Williamsport, Allentown, this is all there is right now. Now, you know, to be fair, Wills is getting it, so, but they'll have in their Ballackinwood office in Philadelphia. There's no one else around. So to be able to offer this technology to our patients is just humbling, to be honest with you.
All right, so walk me back a little bit because I'm not too smart.
That was a lot.
Yeah.
I just kept going and going.
Yeah. No, I know that, and it's very informative. So, okay, so I come in, and you're telling me that, you know, I have macular degeneration, okay? And you tell me about the Valeda, this device. All right, so now when I come in for a treatment, all right, does it hurt? Is there pain?
Nothing.
Okay, nothing.
It's a bright flash of light, different wavelengths. So at one point it's kind of a yellowish looking light. At one point it's red. We actually do one treatment with your eye closed because it's a higher frequency infrared. So it's extremely comfortable.
All right. So you have trained people who know it.
Yes.
Okay, that's a stupid question, but I want to make sure.
Yep.
All right. The second point is that, okay, I know I have to be committed. Okay.
Right.
Now to save my eyesight, okay, the commitment is there. So what's that procedure? How many times do I have to come in? What?
So let's just say Monday you would come and you'd be here about 10, 12 minutes.
Okay.
Then Wednesday and then Friday, let's say.
Okay.
We skip a week and we do the same thing.
You skip a week.
Skip a week. So we could do 3 weeks in a row or we could skip a week. It has to be 3 weeks within a 5-week period.
Okay.
So we could skip a week, or just if someone's going on a cruise, we'll skip a week. If they're going away another point, we'll do 2 weeks in a row. We kind of make it easy for the patient. But you have to have 9 sessions within a 5-week period.
Okay.
But you can't do more than 3 in 1 week.
All right. So after the 9, we should see some results.
Everyone's different. So in Europe again, because this is really where it's been done, you know, the results can be maybe after about 3 months to maybe 6 months is when patients really start noticing the improvement. Probably the worse their eyes are to start, they're going to see improvement quicker. The milder the macular degeneration is, they may not notice much right up front. And I'll be honest with you, someone's vision is still pretty good, but they have it hasn't affected their vision yet. We can still do the treatment because we're preventing it from getting to the point where they lose vision. That's the key. So someone comes in and they're 20, 25, they're still pretty good, and we do the treatment, we're going to preserve that vision and so that they don't get worse. That's kind of the key. And then we'll see them again for 4 months later for another set of treatments, and then 4 months after that, and then we do that again next year. So it's 2 years of treatments.
Okay, so they have to go, but after the first section, then they can wait a year.
No, we do another we start another year right after.
Oh, right
so
after.
It's 2 years in a row.
Okay.
That was the FDA study, and that's how it's done in Europe. So it's 2 years right in a row.
Why do you think it took so long for us to have it here in the United States? I mean, okay, I mean,
the FDA takes a while to approve not only treatments but devices. So the treatment had to be approved, and then the device had to be approved. And our FDA is just pretty conservative when it comes to approving new technology like that. But it's here. That's the thing. It's here. Yeah. And again, we have data from Europe. 500,000 treatments in Europe. It's safe. There's no side effects. You're not going to make it worse. You're only going to make it better.
And it doesn't matter what degree you have macular degeneration.
So right now in the U.S., it's not approved for the wet form. So if patients are getting injections in one eye and they're not in the other, we would treat the eye that's not getting injections right now. That may change in the future, but as of right now, we would treat the dry eye only. And when I ask patients, we have this treatment now, so you don't have to get injections in the other eye, they're like, sign me up. Because patients hate getting injections. It's every 5 to 8 weeks. It's a long process. You're here 2 hours. It's a needle in the eye. We don't want to get to that point. So now we have something that will help us prevent that progression of the disease.
So folks, if you just tuned in, I'm talking to Dr. Thomas Kislan, who is a medical director of Hazleton Eye Specialists and other locations they have. This device behind me can make you see. And I think this is really exciting because I'm thinking to myself, I know not many people, but I know some people who have macular degeneration. And when they hear the eye doctor telling them, you got macular degeneration, oh my God, there goes my sight. We have hope for these people now.
Patients cry. They cry in the chair when I tell them. But now I can say to them, we have a treatment that's going to help prevent this from, progressing to the point where you lose vision.
First of all, you need an eye examination to find out whether you have macular degeneration. Right. Okay. So are there telltale signs that that your eyes there's something happening? Are there any telltale signs to know that you're maybe getting something, macular degeneration?
Blurriness of vision and waviness of things. So floors may look a little wavy. Horizontal or vertical blinds may look a little wavy. Those are some early signs, but honestly, in the earliest stages, patients just have no idea.
You need an eye examination.
You need, especially if you're over 40. There's no reason not to get an eye exam. You just, glaucoma, macular degeneration, these are things now that we can help and prevent from losing your vision.
We're putting a phone number on the screen, and we're going to put the numbers because we show this show in all the locations. So you have the Strasbourg number, you have the Hazleton number, you have the Pottsville number for you to call to make an appointment. And there's 2 locations that have this device. It's the Strasbourg location and the Hazleton location.
And Pottsville actually also. We'll be doing it in Pottsville, yes. Okay. Also.
The exciting thing, Tom, that when you see all of the innovations and you guys have been ahead of in technology for a long time. What advice do you give the people out there who are hesitant? And that would be me. Okay, I mean, my wife would have me kicked out the door because she's the RN. But you're hesitant.
Eye exams are painless. It's not like the old days where you had drops that made you blurry for 6 hours. We have drop-free eye exams. You come in, we use digital imaging. We have all the technology that allows us to be a painless, quick process to really determine not only if you need glasses, that's part of it, but the health of your eyes. And Dr. Diem, my partner, who's just been a great partner in advocating for the health of patients' eyes. When this became, available and we talked about it, there was no hesitation on either of our parts. It's just exciting to be able to provide this treatment to our patients.
Well, I wish you the best. And my friends, I come here every 4 months. I don't get my
And he
money.
complains everything.
Yeah, well, that's true. But I mean, the point is, it's painless now. But the first time, I was a little nervous. I highly recommend, if you get an eye exam, the phone number is on the screen. This is the machine. It's called the Valeda. It's interesting, but it could save your eyesight.
And if I could just, the website is www.myvaleda.com. We're going to have the information on our website also, www.drkislan.com. But if patients have any questions, they can call the office, ask for myself, ask for Dr. Diem, any of the doctors here. We can answer any questions because this is so new. Again, no one else around has it. So there's going to be a lot of questions, but we're here to answer any questions and help our patients.
Take advantage of it, my friends. We'll see you next time.